Hello, the North Suburban Library District is pleased to present a talk about diet trends and fads by Adam Schaefer, who is the Wellness Services Lead and Registered Dietitian at the Center for Nutrition and Weight Management at OSF Healthcare St. Anthony Medical Center. Thank you for tuning in today.
Hello, everyone. So as Nicole pointed out, we're going to be talking about fad diets, and I'm just going to jump right in and talking about the first one that comes to mind when most people that I talk to, one of the most popular ones is the ketogenic diet, or otherwise known as the keto diet. So this one is a very low carbohydrate diet that's high in fat. Often sometimes confused with the Atkins diet, which is also low in carbs, but it's higher in protein. So kind of just a review of the keto diet is it is actually created for treatment of epilepsy patients and actually has shown to be very promising. People are now using it more to see if they can help with weight loss. So kind of the mechanism why they think it may help with weight loss is that if we eat a very low carb diet, our body's ability to use those carbs for immediate energy is not there, and now it has to convert fats or fatty acids into ketones and use that as an energy source. And the process of making those into energy for us is very difficult for the body, which actually means that it's burning more calories to make it happen. So that's what the theory is, and patients can be successful on this diet. However, there are some concerns here and there. So kind of the breakdown, if you were looking at your calories and everything, typically it breaks down to about 75% of your calories is coming from fat, and then another 20% is coming from protein, and then only 5% is coming from carbohydrates. So for me, that's kind of dangerously low for carbohydrates. Usually when I talk to patients, I try to modify it a little bit to be a little bit higher, about 20% or so. And then also, when you are following this diet, to be safe as you can, you want to focus on more plant-based fats. Some patients I'll talk to is eating things like higher saturated fats, such as bacon, sausage, salami, bologna, those types of things that are very processed, high sodium, which could be damaging to your heart and cause high blood pressure and things like that. So we want to make sure that we are focusing on, as I mentioned, plant-based. So we're talking about avocados, nuts and seeds, olive oil, ground flaxseed, those types of things to really get the best benefits if you're going to follow a diet like this. Some people that I don't recommend that should do this, or if they do decide to do this diet, is to make sure that they have supervision from a doctor. So patients including ones that have kidney disease, diabetes, those two are primarily patients that I get a little concerned about that are trying it on their own, because obviously a diet very low in carbohydrates, that's a diabetic. What's happening is you may run into problems with a very low blood sugar, and we don't want you to pass out or anything like that, of course, with low blood sugar. So your goal here is to make sure that you are being properly managed by your doctor or your endocrinologist, whoever manages your diabetes medications. So that way your medications are not overpowering your new changes in diet. And then patients with kidney disease, you want to make sure that your body is filtering out all this extra fats that you're taking in, and a little bit more protein, probably, honestly, that you're taking in normally. So those are both things that you need to make sure you pay attention to. The ketones that are being built up in your body used for energy is also acidic. So if your kidneys are not filtering it out enough, we may also run into having a high acidity in your bloodstream, which could cause damage to your blood vessels and potentially neuropathy and things like that. So, so for the keto diet, like I said, it can work just fine as long as you don't have those conditions or you're followed up by a doctor. But like I said, what I focus on is a little bit higher carbohydrate. So maybe bumping down that fat content to about 55 to 60, and bumping up those carbs to about 20% or 25% at bare minimum. That way you don't have any issues with the low blood sugar. You're still probably limiting your carbohydrate intake, as these carbs are usually what people eat most of. And so if they're eating less, they tend to eat less calories overall. So it does help with weight loss if that is your goal. For other diets, I mean, if your goal is not weight loss, I don't recommend the keto diet. I don't recommend it. Also, like I said, at the true value of what it usually is, if it's 5% carbs, it's just a little too low for most people. You gotta remember that vegetables and fruits also contain carbohydrates that are considered healthy and have fiber and vitamins and minerals. So that's my take on the keto diet. Another popular diet that comes to mind is intermittent fasting. So with intermittent fasting, typically what patients do, or what individuals do, is they fast for anywhere between 12 and 16 hours a day. And then they eat in like a designated time frame. So if it's a 12-hour fast, you eat during a 12-hour period. You can't eat outside those periods. Or if it's a 16-hour fast, it's the same thing. You have an 8-hour window that you're allowing yourself to eat. For example, if you decide to eat between noon and 8, there's your 8-hour window that you can eat, noon and 8 p.m. Anytime outside that, you're not supposed to eat anything. So this diet doesn't necessarily have any restrictions on calorie intake, nutrient intake, or anything like that, which makes it unique to some other typical diets. It's more focused on timing and frequency of your feedings or your eating. So instead, a lot of this is kind of intriguing to most people, because then they are able to basically eat a variety of foods and a lot of the things that they like. And because it's very structured in the timing, some patients do really well with this. Again, if you're diabetic, you may run into problems with low blood sugar, especially if it's a 16-hour fast. So that is concerning. That may be a potential con. If you're someone that likes to eat, I guess, be a grazing diet, so if you're grazing throughout the day, and you're trying to lose weight, this may be a decent diet for you. This may work, because if you're grazing all day long, the structure, timing eating may help you forego those habits of eating all throughout the day. So that's something that would help with those types of patients. However, on the flip side, this may not work for people that skip meals throughout the day. If you're someone that says, I'm not a breakfast person, or I'm not a lunch person, and I usually skip that meal, or I have like just a drink, I'll have like a water, or I'll just have a quick bar out the door and I'm good to go. Potentially this diet may not cause a lot of changes for you in terms of, again, weight loss or any other health benefits. So, you kind of got to see what type of person you are when it comes to eating. Am I someone that grazes a lot throughout the day and I'm finding myself just snacking here and there? And, unfortunately, maybe COVID has caused this, where you're being more bored than usual and you're snacking and grazing throughout the day. Maybe this type of structure will help you. Again, though, be careful with your other health conditions to make sure that this is not affecting your blood sugar, or your blood pressure sometimes may drop a little low if you're taking a high dose medication for hypertension, and then you're not eating anything throughout the day, and it may cause your blood pressure to drop. If your blood pressure drops and you're feeling dizzy, lightheaded, weak, those are good symptoms to make sure that you get checked out, and or maybe reconsider the intermittent fasting route. So again, something that would be beneficial is someone that grazes all the time. It would be a decent diet to try out. But this is why sometimes you'll have one friend that does it, they do really well. The other friend that doesn't, they're like, well, I didn't see a difference. And it might be just the way you already eat. Again, if you're already kind of fasting because you're skipping meals, it's not going to be much of a change to your diet, or much of a change at all. And you get a little frustrated, obviously, if you're not seeing results. So that may be what's happening, and the reason why you're not losing weight, but maybe your friend that's basically the same type of person, maybe same weight, same health conditions, but all of a sudden they're losing weight. And you're like, well, why me? Apparently I can't lose weight. And so if we have that kind of background knowledge, it may give you a different perception on what you should choose for these varying type of diets. So that's, an overview of the intermittent fasting, pros and cons of it, and why maybe somebody should choose it versus not. The next type of diet is the detox diet or cleansing diet. So there's a whole bunch of different versions of this. So I'm just going to categorize it as cleansing or detox. So primarily our liver and or kidneys is supposed to detox our body on a daily basis. Yes, our body does make toxins every day just from regular metabolism that we do need to cleanse. And typically our livers do a very good job of this. The purpose of this diet is to take it to the next step and to see if we can cleanse our body even more of these toxins and kind of hit the reset button on your metabolism is kind of what people are shooting for when they follow a diet like this. So typically these diets consist of what you would classify as clean eating. So what you're doing here is you're eating usually organic type fruits and vegetables, usually in the form of juiced. So you're going to blend up these fruits and vegetables. You're going to have maybe blended nuts and seeds that are, again, unsalted maybe, or very unrefined, so that you can make sure that you're getting the best quality of foods in your body. And typically there's a lot of water and very restricted foods that you can eat in the first place. So if there's a lot of restrictions on the foods that you can eat in the first place, some people have a lot of difficulty following these diets for long term. And honestly, these diets aren't meant for long term. You're going to do a detox diet for maybe 7 to 14 days at most. So as far as an actual diet per se, I wouldn't classify this as a long-term diet, of course. This is just a short-term thing that you will end up having to do something differently right after you're done doing this. Otherwise, you may feel better. You may be with the help of the liver and eat clean eating, you may actually feel much better. You may drop a lot of water weight if you're retaining a lot of fluid from previous salt or preservatives or artificial sweeteners, ingredients that you were consuming before, and then your body had time to clean it all out because you weren't giving it a whole bunch of other quote-unquote junk food. So that's where sometimes patients do well with. However, because it's not long-term, it's so restrictive, we can't possibly rely on that as a thing to do forever and ever. We can't keep on doing these detox diets like every couple of months and hope that that's going to work for us as far as healthy eating or a healthy body. So if you're going to do this, you need a plan B about what you're going to do afterwards. Otherwise, you may lose a bunch of typically water weight. Your body's flushing out a lot of, again, excess water weight sometimes. You might lose a good amount of weight. Unfortunately, as soon as you get off this diet, that water weight may just come right back on, and you go, wow, geez, I lost like 10, 15 pounds in 2 weeks. Fantastic. However, within another 2 or 3 weeks, you put it back on and frustration again sets in. So those are things to consider when you're doing these types of diets or cleanse diets in general, is be sure that you have a plan B. When you're juicing fruits and vegetables, remember that this is not nearly as filling as having the actual fruit or vegetable. So if you actually just eat the vegetable or fruit, you're still getting all the nutrients, just like when you juice, you get all the nutrients from them. I'm not saying you don't. However, the benefit of eating it whole is that your body actually has to break it down, has to digest it. As it's digesting, naturally you are feeling full longer. It takes your body more work. If your body's working harder, you're burning more calories than usual, which is fantastic. So if you're burning more calories, that's going to help you with weight loss. It's going to help you absorb better. You're getting that fiber to get the help with constipation or help with bringing down your cholesterol levels. So any diet that promotes fruits and vegetables is a good diet. However, with the cleansing, since they do juicing, yes, you'll get the vitamins and minerals, but if you put too much fruit in there, you might be getting a high concentrated dose of sugar. And that high concentrated dose of sugar may not help you reach your goals. It may cause an increase in your blood sugar, and if your pancreas works just fine, it'll bring it back down. However, now you're having spikes and lows and highs, even if you're not diabetic. So that's something that we need to be careful of. And again, especially depending on your health conditions, be careful of too. So there's the cleansing diet, or types of cleansing diets to consider. Another type of fad diet, I guess we can say, is, it's all a rage right now, is meal replacements in general. So there's so many out there. We have the Nutrisystem, we have Seattle Sutton, we have HMR, Health Management Resources, we have MetaFast, we have SlimFast. There's a whole bunch of different types of shake programs, Shakeology, through Beachbody. There's a whole bunch of different types of meal replacements that we are getting offered to us. And for a lot of people, it's like, hey, this is nice. It kind of gives me exactly what I need to do. I don't have to think about it, and I can just follow the program. And that's the kind of the great thing about having the meal replacements is you don't have to think about what you're going to eat at the next meal. You don't have to worry about what am I going to prepare. Everything is detailed out for you. So that's the kind of draw for meal replacement programs. It's a structured diet that gives you pre-portioned, foods, and you just need to follow their guidelines. So in most cases, meal replacement programs can be beneficial. They can be successful, especially if you have a very busy lifestyle, at least at the moment. You don't have time to cook healthy meals. Sometimes you're getting carry-out foods. So again, all these fad diets kind of go back to, what does your typical lifestyle look like? Once you figure out your kind of barriers, your weak points, then that might help identify which diet is best for you. So again, for the meal replacement programs, it's usually beneficial for people that have a very busy lifestyle, can't find time to cook, tend to do fast food a lot, or carry out because they don't have time to cook. And so if they can take away that carry out and fast food, because unfortunately we know that's not going to be very healthy choices for us, and do pre-portioned meal replacements, sometimes that can be a good option for them. A con of this type of eating, though, is a lot of times it's very expensive. So many people can't afford, paying $100, $200 even a week for foods. So that's not an option in the first place. You can't pay that much every week. Other people, maybe that's not a problem for them, and that works still for their lifestyle. Also, if you're going to do a meal replacement program, again, kind of like the cleansing diet, make sure that you have a plan B, because I don't want you to be doing the diet, the meal replacements, and typically it's a short-term thing. You're on meal replacements for a couple months, 6 months, a year at most. You lose a great amount of weight because you're getting pre-portioned meals. You're not over-consuming calories because of these pre-portioned meals. Hopefully you're regulating your hunger cues. You're getting better at kind of resetting your metabolism because it's completely overhauling your old habits by focusing just on the meal replacements. But as soon as you get off the meal replacements, again, you want to have a plan B. You don't want to fall back into old eating habits because you've lost 50 pounds or you got to your goal labs or whatever you needed to do. And then you're like, okay, great, I'm cured. I can go back to the way I was. And that's usually the problem that people fall into. They get comfortable. They get very, comfortable on how they've been doing. And let's see if I can just keep this off by slowly getting back into my old eating habits. Instead, you need to make sure that you're exercising. All of these diets don't really talk about exercising very much, but exercising, of course, is needed. So a lot of these diets don't focus on that. And then, so we need to make sure that we're exercising. We need to make sure that we are maybe going to some type of classes or support group, or have a health coach or a dietitian helping you out on what to do after this is all said and done. How are you going to cook differently? What are you going to, maybe you need to cook in bulk and repurpose your meals throughout the week, or meal plan a little bit better. Why you're doing the meal replacements, trying to figure out, take this time. Your diet's already created for you. So when I see people on meal replacement programs, I usually tell them, follow it exactly to a T. But also in the meantime, you don't have to think about your food. So focus on your exercise to make that a habit before you get off the meal replacements. Also, try to think about planning your meals, so when you do get off of the meal replacements, you have a plan to know what you're going to do next. Once you have a plan and exercise routine, your likelihood of maintaining this success you've had is higher. But unfortunately, some people don't take advantage of that opportunity when they're on these various different meal replacements. So this type of meal replacement programs can be very beneficial. They're pricey though sometimes, and if you don't do anything differently throughout that process, you're just going to go back to your old weight if you didn't change your lifestyle. So making sure we're doing that. One program in particular I would like to talk about, a commercial program, is Weight Watchers. So Weight Watchers is obviously huge. It's the most popular program out there that's a commercial program, and they use smart points. So they use a point-based system that kind of grades, I guess you can say, foods. So you can, say like, oh, I eat this food, it's worth this many points. You get a certain amount of points every day, and based on the number of points that you have, that determines how much you eat. So the great thing about this system is it does kind of identify kind of what you can eat, but it also provides a lot of flexibility because there's no technical restrictions on what types of foods you can eat. So this is a good thing and a bad thing. The good thing is it simplifies what you can do and what you can't do, and it really helps maximize moderation. You have points, so you can moderate how much you use. You can kind of budget on what you can use them for. Like I said, it doesn't necessarily say you can't have a sweet or candy. However, you want to make sure that you're not eating a whole bunch of fudge bars, for example. Technically, you could eat a whole bunch of junk food as long as your points add up correctly. I would assume most people don't do this, but hopefully we don't. And making sure that we are eating as healthy as we can following this point system. So it does work really well, especially if you're doing the classes. Classes and the program altogether can be a little pricey for some people. But I do think if you follow every single thing that they provide in this program, it can be a very good program. And it does kind of teach you long-term skills if you go to the classes, or at least have an online coach or something along those lines. So Weight Watchers can be a decent option for you. A lot of people have tried it in the past. And so you may have good or bad feelings about it. You might say, well, yeah, it worked the first time I did it, the second and third time, not so much. Well, then, okay, it's time to move on and trying to figure out what else works for you. But if you haven't tried it before, that might be a good place to start because it gives you some of the basic foundations. It gives you a point system, kind of, like I said, grade the foods. So you can kind of see like, oh, okay, well, I can get away with having a bunch of fruits and vegetables and versus having this one food item that I know isn't healthy for me, and it shows. It's worth a lot of points, and I'm going to be hungry if I only have this little portion size of it. So it does teach you a little bit of somewhat correlation between nutrient-dense foods versus calorie-dense foods with these point systems. So making sure that we are following the support groups that they offer or the classes that they offer can really help you kind of boost your success rate in that program. So another diet that I skimmed over a little bit with is the Atkins diet. I talked about it briefly when I talked about the ketogenic diet. So the Atkins diet and the ketogenic diet is often intermingled together when I talk to patients. The Atkins diet is where you are still following a low-carb diet, similarly to the keto diet. You're more focused on trying to increase that protein intake more than the fat intake. So that's the difference between the Atkins and the ketogenic diet is it's more of a low-carb, high-protein diet rather than a low-carb, high-fat diet, which would be the keto diet. So the high-protein diet, again, you want to focus on for heart-healthy fats and proteins. You want to focus on lean meats, again, chicken, fish, things like that. However, this diet doesn't necessarily tell you that you have to, only eat lean meats. They just say protein sources in general. So if you're eating a lot of cheeses, which are low carb, high protein, if you're eating a lot of fried fish, which can be, unhealthy because of the fact that it's fried, or breaded chicken again, or pork sausage, or anything else like that, that again may be highly processed or very fatty and high in saturated fat. It may result in weight loss, but you still might end up with concerns with heart conditions. So you still have to be careful when you're following this type of diet too, for the same reasons, making sure you're still getting heart-healthy fats and the proteins that you do eat are lean. And if you do have dairy products, you may want to moderate the amount of actual cheese that you have, and even milk products because of the saturated fat in those cheese products. Also, regular cheese with the sodium content. Again, people that are eating hot dogs and sausages and brats and stuff like that don't realize that, yes, it can be lower calorie or low carb, but a lot of times I see patients that the sodium content is so high. And this is sometimes an often forgotten nutrient with all these types of diets is sodium. I'll have somebody that's counting their calories and they're down to 1,200 calories a day and they're like, I'm doing everything I can, I'm exercising, I'm not losing weight, or I'm not getting to kind of what I need on my labs. And we look at their diet and they're having, pickles, and they're having green olives, and they're having low carb breads and tortilla shells, but their sodium is through the roof, or they're having soups, or they're having hidden sodium foods that may be causing them to have some water retention. So when you eat too much sodium, what's happening is your body's retaining a lot of fluids, and you're having, basically it dilutes the sodium in your body. So if it dilutes the sodium in your body, it's retaining that fluid. If it's retaining fluid, then your body is focusing on trying to get rid of it rather than normal metabolism. So instead, we want to make sure that we're limiting our sodium intake in addition to paying attention to everything else we eat. That's why the nutrition facts labels has not just calories, fat, protein, carbs, cholesterol, sodium, all those different things, fiber, sugar. We want to pay attention to all those things. And a lot of times, a lot of these fad diets focus on eliminating certain macronutrients, protein, carbs, fat. Their low-fat diets were all the rage back in the 90s, 80s. So instead, we need to focus more on holistic as far as including all those nutrients, all the macronutrients, the protein, carbs, the fat, making sure that we get all of those instead. And so going back to the Atkins diet, it can be healthy. Again, we need to make sure that we're picking quality proteins and fats. So lean meats, potentially high protein vegetable, sources, tofu, for example, seitan, beans, black beans, kidney beans, garbanzo beans, chickpeas, any of those types of beans or lentils would be perfectly acceptable for protein sources that are going to be also cholesterol free. So when it's plant-based, it's cholesterol free. So those all things can be very beneficial for you. Okay, so those are a variety of diets. Unfortunately, there's so many different ones out there. that I didn't touch on, so I'm not sure if there's a follow-up session for this, but we can always, if there's one that I didn't touch on, we can always go back to it. But next I want to talk about kind of what are some long-term diets that I should follow. A lot of these are short-term, and I understand that, and that's great to kind of give me a starting point. But yeah, they aren't meant to be long-term. I have a really hard time following these long-term. They're so restrictive or things like that. So making sure that, or let's seeing what we can pick for more of a long-term diet plan. So I've come up with like 3 consider would be a good option for you. The first one would be the Mediterranean diet. So the Mediterranean diet has been around for a very long time. It's always ranked very highly of most physicians, dietitians, any health field for the most part. Of course, one of the cornerstones of it is it really promotes fruits and vegetables. All these diets I'm going to be talking about that are for long-term health are fruits and vegetables. Vegetables are very filling. They provide minimal amount of calories, a lot of vitamins and minerals, fiber. So for me, I personally use it more as an appetite suppressant than for, obviously I get the nutrients and everything, but from someone that may want to consume larger portions, you can get away with having a large portion of vegetables versus restricting yourself from, I can't have potatoes, I can't have other starches, breads, pastas, rice. You're really trying to restrict it. Now you have a meal that's, basically the size of your palm, versus having 3 cups of broccoli or 3 cups of green beans, or, those non-starchy vegetables that, hey, I'm eating 3 cups of this and it's only about 100 calories. That's awesome. That gives you a lot of portions to feel full and not deprived when you're following a diet. So that's why, these long-term diets always praise fruits and vegetables. With the Mediterranean diet also, they focus on olive oil. That's a staple in their diet. So olive oil has those heart-healthy fatty acids, having monounsaturated fats that give you that heart-healthy benefit will help increase that HDL cholesterol, which is your good cholesterol, and making sure that you're healthy. And so they use it in salad dressings, they use it in their cooking, a variety of things. They also encourage nuts and seeds, they encourage fish twice a week, they encourage whole grains, so it's not a low-carb diet. They still want you to have whole grains, so making sure that you're having whole wheat pasta or whole wheat bread, 100%, make sure it's 100%, not, in the labels it might say whole grain or multi-grain. It still may not be 100%. So you want to make sure that the first ingredient says whole wheat or whole grain product and the first ingredient of any of these products you're looking at. And then things that maybe you want to limit when you're following this diet, they do encourage cheese and they do encourage yogurt, but they still say that it should be in moderation. Eggs are also sometimes, and poultry are also sometimes considered to be in moderation. They really cut down on beef for the Mediterranean diet, and they encourage, you can have some wine, red wine preferably. It's going to be red, non-sweet, more of a bitter type that get those chemicals of phytonutrients that are helpful to you. But in moderation, of course, too. 1 for 1 serving, which is 5 ounces of wine for women, up to 2 servings for men. But that's not a requirement of the diet, but it is something that is listed. So the Mediterranean diet, if you're looking for more of a long-term solution, that's a good start. Another type of diet is the DASH diet, often praised by cardiologists. So the DASH diet stands for Dietary Approaches to Stop Hypertension. And so with this diet, as the name implies, it's meant to be heart healthy and kind of reduce your sodium intake. So this one can be very difficult to follow, but if you're someone that really likes structure and guidelines, they spell it out for you. They tell you how many servings of grains you should have, how many servings of fruits, how many servings of vegetables, your sodium intake, whether you have high blood pressure or normal blood pressure. If it's high blood pressure, they specifically say no more than 1,500 milligrams of sodium. If you have regular blood pressure, but you want to keep it regular, no more than 2,300 milligrams of sodium. So they're very specific. And some patients or individuals need that. They need those specific guidelines to say, what do I do? And, something that may be helpful when you're following a program like this that gives you a lot of guidelines is to do like some type of food log or a phone app to log your food. A lot of phone apps nowadays will give you a breakdown of your carbs, your protein, your fats, your calories, your sodium, potassium, all your nutrients, as long as you log it in. So if this is new to you, that's something too, to get a baseline of like what is going on anyway. I need to figure out, first of all, what my barriers are. Am I eating too much cholesterol? Am I having too much sodium, too many calories? Doing a food log or something like that would help. So going back to the DASH diet, I digress. So just to be more specific, and I'm going to look at my notes here. So for the lean protein, they recommend 6 ounces or fewer per day. So 6 ounces, for a lot of us, we might have an 8-ounce steak or a 12-ounce steak when we go out to eat. We're already over our amount. So Americans in general, we tend to eat too large of portions of meat. 6 ounces is 2 decks of cards worth. Some people say the palm of their hand. Everyone's palm of their hand's different sizes. So I think deck of cards is usually a little bit better option. And then we have, like I said, sodium is something that needs to be watched out. And then grains, this is not something that's a low carbohydrate diet by any means. They're going to be saying fruits and vegetables, which is going to have some carbs, and then they're going to tell you a certain amount of grains, so on and so forth. But I did want to point out protein specifically is only 6 ounces, which is kind of unique. This diet is 55% carbohydrates, so it's very different than the current diets that we're seeing nowadays that are very focused on low carb. But over and over again, when they do a review of all these different types of diets, the DASH diet, the Mediterranean diet, often scored very highly for their health benefits, weight loss benefits, diabetes control, heart disease control. It's kind of a gamut of all these health conditions that help prevent these things. The last one I would recommend to look into is the flexitarian diet. So again, there's other ones that I didn't talk about that can be beneficial, but the flexitarian diet was created by a dietitian, and the whole point of it is to focus on not necessarily being a vegetarian, but as the name implies, a flexitarian. So you can eat, some days you're going to have some meat, but some days you're going to have meatless days, and you're going to be focusing on vegetarian sources of protein. Again, tofu, beans, lentils, meat substitutes are things that you may experiment with. With this diet, there's a whole bunch of different types of recipes to look into. So if you're someone that likes to cook, all 3 of these, Mediterranean DASH diet and flexitarian diet, all 3 of these really challenge your cooking skills and make sure that you can have a whole variety of foods. And that's why they're great for long term. However, if you're someone that doesn't like to cook or doesn't know how to cook very well, these diets may be troubling. However, it's never too late to start learning how. You don't have to be a chef by any means. I keep on telling people when I see them individually that, there's some simple recipes out there that are 5 ingredients or less that could still be fitting these guidelines that are mentioning earlier. So don't sell yourself short. You might be surprised on what is out there and what may be useful to add to your diet. So going back to the flexitarian diet, she breaks it down, the dietitian breaks it down into 1,500 calories a day, typically. That's kind of a standard. Everyone's slightly different in their calorie needs, but based on what this diet recommends, you do a 3-4-5 regimen. So 300 calories for breakfast, roughly 400 calories for lunch, 500 calories for dinner, and then 2 snacks that are about 150 calories. So this kind of goes up to about 1,500 calories a day. So for, again, the people that like those guidelines, it gives them exactly the guidelines that they need. Other people, again, they're like, oh, that's just too much counting, too much math. I'm not going to worry about that. And that's maybe where the apps come in handy. Or maybe you just want to follow the basics of this diet and do, the few meatless days and also adding in the meat days and in moderation. This diet is very focused on moderation, fruits and vegetables, more vegetables than anything else. And then alcohol is very limited. That's one thing that's going to be limited. And then refined products, and basically anything that's boxed, boxed macaroni and cheese, of course, would not be something that you would have in this diet, or anything else that would be processed. So again, all of these 3 diets, the flexitarian, Mediterranean, DASH, are recommended for long-term use. The other ones I mentioned earlier may work for a temporary time if you really want to do something different. But again, you want to look at your current lifestyle, see which one may be best suited for you and your health conditions. Your health conditions can maybe eliminate some diets that you should never try in the first place, as it may cause more problems than help. So that's all I have for you today. If you have any questions, you can always reach out to me. Again, my name is Adam Schaefer, and I'm happy to be here. Thank you.